Everybody, it's Dr. Eric Balcavage and Dr. Erica Riggleman for the Thyroid Answers podcast. How are you, Dr. Erica?
I'm doing fabulous today.
Well, we have a special guest today, live from across the seas. We have Tina Christoudias, right? Spyrou?
Yes,
Did I get that right? I
yes,
told you I was going to have a hard time with this.
You got it.
So we have her on the podcast today. We're going to talk about diet and food and a number of things when it comes to thyroid issues and Hashimoto's. She is a Harvard-trained, functional, registered dietitian who you've had your own thyroid struggles and Hashimoto struggles yourself, correct?
Correct, yes.
So I know you've got a beautiful bio that we're going to put in the show notes, but why don't you just get right in and tell us a little bit of our listeners a little bit about you and how you got into this whole world of not just dietitian type stuff, but especially focusing on thyroid and Hashimoto's.
Sure. Well, I guess the best way to kind of describe it is that every passion is born from personal experience. And knowing what I know now, I probably had a thyroid problem from like 15 years old, because I was always that teenager that was an overachiever, that was a perfectionist, that always got straight A's, that was involved in so many extracurricular activities, especially in music and being on stage. And I was always that little bit extra more tired than the rest of the teenagers in my class. But I just found it as normal that that's me, that I need to take a nap every now and again when I feel tired or when I feel that I can't cope. And that kind of carried on into my 20s. Even though I was active, I would go to the gym regularly. After the gym, I would need a nap. And sometimes when I couldn't handle things anymore, I would always be struggling to keep my weight down as well. I would just, kind of shut off and become antisocial. And that was just how I dealt with things. I never thought to myself, oh, this must be a problem. Oh, this must be a thyroid issue. Fast forwarding to my 30s, I discovered by myself, because I lived through my mother having hypothyroidism, that I was falling asleep at like 7 o'clock at night, feeling exhausted. And I thought to myself, okay, maybe my thyroid's playing up. And I went and got it checked, and sure enough, my TSH, or as we all know it as the thyroid stimulating hormone, was about 15, which is high. And so I went to the endocrinologist. He started me on thyroxine, and I thought that was the end of that. And my issues didn't really start until I gave birth to my daughter when I was about 33 years old, so about 8 years ago. And I would say I gained about 7 kilos during the pregnancy, so that's about 15 pounds during the pregnancy. But 4 months out, I had gained about 20 pounds without really changing anything. I was depressed. I was having issues going to the toilet for weeks at a time. I was severely constipated. My hair was falling out. I was having panic attacks. I became very antisocial. I couldn't really concentrate when my patients, or anybody for that matter, would talk to me, so I extracted myself from the world. And I had gone to a doctor, and he was more concerned about the weight I put on than anything else. And his reaction was kind of like, oh, well, you are a dietitian and you don't know how to lose the weight? You should be ashamed of yourself. Start running. Sorry about that Greek accent, but that's how it's
all right. If anybody's going to try and fake a Greek accent, it should be you, not us, right?
So basically, I found no support there, and I left feeling more deflated. And I was very down, and it wasn't until my husband kind of found that support for me, and he found a book called Stop the Thyroid Madness. I started reading through that, and I started relating to it a lot. We had found an integrative doctor in London, and we went there, and he started telling me about nutrition and supplements. He had put me on desiccated thyroid, and within about a week and a half, I would say my brain fog lifted. I started concentrating. I started going to the toilet more regularly. And it was like my aha moment, because as a registered dietitian, I had a lot of clinical training, like in-hospital training at Harvard. So we were taught about tube feedings, or how to feed patients if their gut was compromised. So we were taught how to read lab work. And this is helpful, but on an outpatient scale, our main focus was on carbohydrates, proteins, and fats, how to break those down, and calories. And that's what we would counsel people on. We were taught about diabetes maintenance. We were taught about weight maintenance, or how to maintain a desperate disease state. We were never taught about how nutrition can be a game changer and a very important part of the therapy when it comes to a chronic disease, a chronic ailment such as Hashimoto's thyroiditis. So you can imagine now that here I am as this patient, and this newfound knowledge, I really started becoming a guinea pig on myself. And I started going through a lot of research as well. And then I had written my book about how nutrition can alleviate a lot of the symptoms of having Hashimoto's thyroiditis or hypothyroidism. And now in my training, I'm actually getting certified to the Institute of Functional Medicine to become a functional medicine practitioner. And it is such exciting stuff. And I think, Dr. Eric, you and I kind of spoke about it, that now the more I'm learning, I feel like the less I know. There's just so much to know. The body is such an amazing instrument that it also becomes an art when it comes to helping people and trying to get them on the right path. So this is where I am right now, and it's like really exciting times for me, I believe. I'm very excited to be in this field.
Well, I think that's great. I think we typically find anybody who gets involved in this world of kind of functional medicine usually has their own backstory, which kind of drives them into that. I think it's interesting when you talk about your training was mostly disease management focused, right? And it was on disease. And when we talk about health and we talk about diabetes, we talk about how to be a good diabetic, right? Versus how to become non-diabetic, and how nutrition really helps heal and repair. I would guess that a lot of the training didn't really focus as much on how the nutrition is actually causing your disease, but how you could just manage macromolecules. And that was the calories in, calories out was the secret to everything.
Exactly.
I think there's a misperception, I think, even in our industry, sometimes when we talk to dietitians, in that they're kind of their thought process, and you can correct me if I'm wrong, and you probably already know this because you're a bit different probably than many of your colleagues, is that when we look at dietitians, we kind of see the classical allopathic training, and it's really different from us and how we look at patients and diet nutrition in the functional world. Would you say that's correct?
Yeah, and I can give an example. There's an amazing researcher that's deceased now. She did a lot of her research in lipids at the University of Maryland, Dr. Mary Enig.
Yeah.
And she talked about how saturated fats are actually good for you and that actually help a lot of the processes within your body. And she found it very strange how all her students that were getting PhDs in nutrition had a very different reality of what nutrition was from even the dietitians getting trained within the University of Maryland. So even in one university, you saw that this very different way of approaching nutrition and how nutrition can change your health. And talking with even a lot of people they have a lot of their studies done in biochemistry, I feel that they have a better grasp of nutrition than how we were trained as registered dietitians. So absolutely, what you said is 100% true.
I kind of understand where you're coming from. I have a master's degree in nutrition, and I had already kind of gone into the whole functional medicine realm prior to starting my master's program. So when I was going through the curriculum, it amazed me how it was so based on fats, carbs, and proteins, and it was calorie in, calorie out. And going through there, I often, to be able to pass tests and things like that, I kind of had to put my blinders on and say, okay, well, I'm going to answer this question because I know what the answer they want. But in my mind, it's not black and white. There's always kind of a gray area. And, looking at that, I often found that my professors, when they were teaching us this stuff, it amazed me that they could only see one side of it. And it was just, this is how the guidelines are written. This is how people should be eating based upon the pyramid. And, you know, when you get on to clinical practice, people just don't fit into those little boxes either.
Exactly, exactly. And it's so true what you said, that, you know, all these being trained with blinders on, that is, I think, one of the biggest weaknesses that conventional medicine, conventional dietetics, conventional whatever has. I mean, we're awesome at treating acute conditions, like, you know, if you're in a car accident and the surgeon needs to save your life and, you know, pump adrenaline into your heart so that it can start beating again. I mean, I think we're awesome at doing things like that, but I think we fall short severely in treating chronic disease. And I think instead of, focusing on how we can maintain a disease state, we should be looking at maintaining health and optimizing health instead.
Yeah, I think that's a great point. I did a number of years. I worked in the hospital setting, and I can, you know, you go see what the people that were in the hospital with chronic illness, chronic disease, and then you look at what they were eating oftentimes as part of the prepared meals, and I would shake my head. And that was back when I didn't really know anything about nutrition. And I would look at those meals and be like, why are we feeding all this sugar and to somebody who's chronically ill or sick? It just didn't make sense to me back then. It makes less sense to me now, but I'm more understanding that this is how people were trained. So they're doing what they were trained. And so we shouldn't really expect anything different, but it is unique sometimes when somebody like yourself steps outside of that box and said, hey, what I'm doing isn't really working right. So I need to find something else out, which kind of led you on that journey. So you're going through your dietitian school, right? Getting your training, and then you develop hypothyroidism, right? Initially, did they diagnose it as Hashimoto's, or how did that diagnosis come about?
No, I had no idea what Hashimoto's even was. They just said, you're hypothyroid, you need to start thyroxine, and that was it.
Okay. And then you didn't necessarily see all the changes you were hoping to see. Is that correct?
Yeah, I thought that, I'm like, oh, this is why I have problems not losing weight or keeping my weight down. So cool, I'll take this little pill and I'll be good to go. Yeah, that they never came.
So we see that quite a bit, and Dr. Erica and I talk about what we call cellular hypothyroidism. So lack of T3 getting to the nucleus of your cells, which results in the hypothyroid symptoms to begin with. And just because we dump a bunch of thyroid hormone into the bloodstream doesn't necessarily mean it's getting into the cell, getting converted to T3, and then stimulating metabolism, which is obviously what wasn't working for you, right? So we have this cellular hypothyroid state. At what point did you start to decide that, hey, maybe my diet and my nutrition has an impact on what potentially is causing or contributing to my hypothyroid symptoms?
Well, that happened when I went to the integrative doctor in London. He kind of started saying, well, maybe you should cut out gluten. And, you know, as registered dietitians, I was kind of like suspicious of this. I was like, yeah, but gluten is only for people that you're supposed to take it out when you have celiac disease. I don't have celiac disease. Because at that point, remember, I had no idea that it was an autoimmune condition.
Right.
And so I said, heck, I got to try something because I'm not feeling well. And for me, cutting out gluten was like a godsend. Like in 2 weeks, I had lost 10 pounds. And, you know, I was eating the same amount of calories. I had just completely cut out gluten and a bunch of grains. And I was focusing more on eating a lot more vegetables and getting more high quality protein and fats into the diet. And so then I had also, through my kind of learning about this, cut out dairy as well. And that was interesting because I had very irregular cycles, period cycles from the age of 12. When I cut out dairy, my acne cleared up and I started getting my period regularly without so many symptoms. So those were like huge for me, cutting out gluten and cutting out dairy. And getting away from recommending like fake food. So as registered dietitians, we were like, get low-fat cheese. you know, like plastic cheese, and you're wondering what the heck is in it. Yeah, like that's what we would recommend. So moving away from that and going back to a common sense approach and going back to your roots and eating real food. You know, I think there's such a disconnect between how our food is produced, where it's coming from, and us. I think there's a huge disconnect. We're just like used to getting stuff from the supermarket. And if you think about it, 90% of the food or fake food that you find in a supermarket is dead. There's no enzymes in it. There's no probiotics in it. There's no nothing in it. It's just dead food made to look pretty on a shelf. That's it. And if you think about it, what's that?
It's money making, and it works.
Yeah, exactly. And so if you think about the common sense approach, so if I'm eating 90% of my food, which is dead, and I'm eating dead food, what does that make me? Slowly but surely. You know?
Yes.
So those kind of little connections started to come into play with me. And then I did a certification about 1.5 years ago to become an autoimmune paleo certified coach, which was developed by Dr. Sarah Ballantyne. And you know, I tend to stay away from dogma now, like following AIP, following paleo, following vegan, following this, that, and the other. And I really try to look at the individual and what works for them. However, what AIP taught me, the autoimmune paleo protocol, is that why I really enjoy it is because it is a process that's given to people for them to discover what works for them and what doesn't. Not only with food, but with lifestyle choices like exercise and sleep rituals and stress management and finding support systems. And we see that overall health is a collection of all of these things. And all of these things should be talked about and addressed and really geared towards the individual and not given a one-size-fits-all protocol for everybody. So for example, as a registered dietitian in diabetes, we're taught that, okay, every 3 hours, you should be giving a little bit of carbohydrate and a little bit of protein. And that's for everybody. Again, concentrating on those macros and not really giving any attention to nutrient deficits, what's going on with their gut, if they're even absorbing what they're eating, and all these things that we concentrate on in functional medicine.
Yeah, I think if you go ahead, Erica.
I think it's important to look at the person as a whole. And like you said, not every diet program is going to fit for every single person. And, you know, just like we've become disconnected from our food, we've also become disconnected from ourselves. We don't really know what things are triggers for us because we've just been bombarded our bodies so much that we don't realize that the gluten that we're eating or the dairy that we're eating or even the processed food is maybe making us feel terrible because we already feel terrible. We're already at that threshold. And so, you know, part of the process, I think, is coming back in tune to your body, listening to it. You know, again, not every single program, you know, some people do good on keto, some people don't do good on keto, and you have to kind of, you know, I love that it is part of a process. You've got to learn what your triggers are because every single person is going to have different triggers when it comes to their autoimmunity.
Yeah, and that's why it's so important for them to work with coaches such as yourselves to help them, guide them toward learning more about themselves, because everybody's different. I can't stress that enough. I see so many people like, well, my cousin, they went on the keto diet and they lost like 30 pounds and they're feeling amazing. But when I do it, I have a headache and I can't deal and I feel shaky. And it's really hard trying to convince somebody that it's not a one-size-fits-all solution. Everybody is different.
Yeah, I would say that everybody is a bit different, but if we had to give our listeners or the viewers a basic recommendation, dietary recommendation from somebody like you who's a dietitian, now that you've changed your mindset from the traditional teaching to where you're at now, what would be the general nutritional principle that you would give to just anybody to improve their health and well-being? What would that general dietary principles be?
Sure. Well, my go-to with any client is to start an elimination diet. And of course, we have these food sensitivity tests which in my professional opinion, I don't really see any benefit from them. Like I can get a little bit of information from them, but what I see works the best as a gold standard to kind of start identifying which foods work and which foods don't is to go on an elimination diet. And there we kind of focus on the usual culprits. So I will start with gluten and dairy and sugar and processed foods, completely take those out of the diet for about 6 weeks. If we see that minimal decrease in symptoms, I will move them on to a full autoimmune paleo elimination diet. And so that we start eliminating all grains, all dairy, things like nightshade vegetables, which are your bell peppers and your tomatoes and potatoes and eggplants, and goji berries, those are nightshades too. We take out legumes and beans, and we take out specific spices as well. And the reason for this is that all of these foods do show that they stimulate the immune system in a bad way if you have an autoimmune condition. When it comes to autoimmunity, we don't necessarily want to stimulate and overdrive your immune system. We want to balance it. So a lot of the time, we take out these foods because they're also known foods to irritate the lining of the intestine. And as you guys know, 80% of the immune system surrounds our intestines. So there's a very huge connection between what certain foods do and how our immune systems respond to that. And there's not much research on it. There was a study done by Angela Alt, which is one of my mentors, and her team on about 15 patients with ulcerative colitis. And they found that it was over a 15-week period of being on the autoimmune protocol. And what they found that was even within 5 weeks, they were seeing amazing results in the patient's endoscopies. So this is very hopeful research. I mean, much more randomized trials need to be done to assess like the effectiveness of AIP. But I've also seen amazing results in my Hashimoto's patients where patients would be filled with nodules on their thyroid. And after 9 months of strictly following the elimination part of the autoimmune protocol, they were able to see a reversal of those nodules and have come out with a clean thyroid. So, and this is diet only, like not touching anything else. So right. We can definitely, after the elimination part, there's a second phase of the autoimmune protocol, and that's reintroductions. So you start one by one reintroducing the foods we've eliminated, and you give yourself some time, like 3-4 days for each reintroduction. And if you see symptoms, so if you have a sensitivity or an intolerance, it's not like an allergic reaction where you're immediately going to itch or immediately get hives or something like that. You're going to see symptoms like 3, 4, 5 days out. So for example, let's say you reintroduce almonds, and on the 3rd day you start getting headaches and you start getting bloated. This is a food sensitivity. It takes a little bit of time for your body to understand that there's an issue with it. It's not to say, though, that if you introduce something today, that if you reintroduce it again in 3 months, that you won't have a problem with it. Because that's the point. We want to get your gut to a point where you're able to tolerate most foods. We want to heal the gut. And as you guys know, functional medicine says, when in doubt, start with the gut. So
yeah.
It's part of the process.
Let me just kind of make sure the listeners understand. I think what we're discussing is in the initial phase of anybody who's got some chronic health issues or they just want to be healthy. One of the primary things we can do is just go back to eating real food, right?
Yeah.
With the processed food, that's step one for almost everybody. I think you'd agree with that, and I think that's kind of
100%.
the step you're talking about. Dr. Eric and I talk about that as well. There's so many good foods that people don't eat. And we start many times taking foods away. People are like, well, you can't eat nightshades or all these things before you've even just gotten rid of the processed foods. So I would say, and you can correct me if you think differently, is getting back to a whole food diet and get rid of the processed food. That's usually a huge step one, right?
Definitely. That's a huge step one. Definitely.
And that helps you with that kind of that elimination piece if you take away those more problematic foods. Because it's crazy sometimes to me, and maybe to both of you, that somebody will say, well, you can't eat nightshades because they're unhealthy for you, but yet we're not talking about the frankenfood that we're giving them in gluten-free processed foods, right? So there's more value in the dead frankenfood, and we're not as concerned about that as we are the eggplant, right? Or the green pepper, right? And
yeah,
so,
no, I think that's a very, very good point. Like gluten-free does not mean eating additive-filled gluten-free products. Gluten-free means going back to real food. And again, a very good point that you brought up is that another very huge, even more important part of like something like the autoimmune paleo protocol is nutrient density. What can we put back into the meal plans or back into your daily eating habits that will bring back nutrient density? Because ultimately that's what's going to heal you. And one very easy rule to follow, even if you're not okay with the nightshades in the beginning, is eat the colors of the rainbow every single day. All those colors are jam-packed with phytonutrients. I mean, we're kind of obsessed with vitamins and minerals, but they're just uncovering all these thousands of phytonutrients only now that are found in all these different colors in our fruits and vegetables. So even if you're confused, even just doing that, eating the colors of the rainbow every single day is a great place to start.
Yeah,
excellent.
I think getting variety is important too, because we all see the patient that comes in that is very, type A, strict. I eat this for breakfast, this for lunch, and this for dinner every single day of the week. And that consists of maybe 2 or 3 vegetables, and they never get outside of that realm. So, they're not getting the colors of the rainbow. They're not getting all the vitamins and minerals. They're not covering all of their bases. And that even goes to with meats too. You'll see somebody who will only eat chicken and they're not getting any other source of protein in their diet. They may not be getting all of the amino acids in the ratios that they truly need either. So I think that, eating the color of the rainbow is important. And then, trying new things. There's so many vegetables out there that people probably have never even heard of, and experimenting can be fun and exciting. It can be scary, but on the flip side of that, you can get more variety, which it's a learning process.
Yeah, definitely. I think that's such a good point, Dr. Erica, that getting nutrient density, getting a variety, I think it also stems from our culture that we're either on a diet and we're restricting calories, that calorie mentality again, or we're not on a diet and we can just eat freely all the junk there is out there. And it's kind of hard to escape that. I know I had issues with myself trying to escape that kind of a mentality until you learn how food is really and truly your medicine. And it's not about how many calories you're eating. It really is what you're eating. And that kind of scares people again, because it's kind of like there's so much information about what the right diet is. Well, that's relative. But I think a very good point that Dr. Eric also said, and you said, is to put variety in the diet and just go back to real whole foods.
Excellent. So in your process, so now we've got patients, we got just regular people saying, okay, I got to eat more real whole foods. Do that first. That's step 1. Step 2, if they're still having some challenges, then you've kind of done an elimination diet to some degree already by doing this process, but
Right.
You get in a little bit more in depth with them. So if they've gotten they're now on this kind of whole food diet and they're still struggling with issues, what's that next step that you see as the dietitian that they need to kind of work themselves through?
Well, the next step, like if this is where we start kind of exceeding the boundaries of like the nutrition part and kind of going into root causes, like the functional medicine part. And of course, we're gonna look at the gut. We're gonna look if there's any dysbiosis going on. So, an imbalance of that microbiome, not enough good bacteria, too many bad bacteria. If there's a parasitic overgrowth, if like what I see a lot in Hashimoto's patients is a decrease in stomach acid. And we know that we need that stomach acid to absorb your minerals, so selenium and zinc and iron and B12 even. You need a good amount of stomach acid to start the process of absorbing those minerals. And by the way, all those minerals and vitamin that I just mentioned are so important to the formation of, from T4, the storage form of thyroid hormone, to T3, the active form of thyroid hormone. So a lot of the time, the root cause of not being able to transform T4 to T3 starts in the stomach by not having enough stomach acid. So it's looking for those root causes afterwards. So I have my patients fill out like this huge symptom questionnaire, and through the discovery process, kind of see what kind of other issues are going on. You can tell a lot from the skin. You can tell a lot from the hair. You can tell a lot from the whites of the eyes, if they're white or not, if they're a bit red. You can tell a lot from the nails. If you have, like spots on your nails, that could be a selenium or zinc deficiency. If you don't have like the round moon circles around your nails, that could be a protein deficiency. If you have swelling around your ankles and your limbs, that could also be a sign of protein deficiency, which again starts with having enough acidity in your stomach. So I only mentioned a few things here, but I'm probably confusing people.
No. I think you're doing a good job. And that is to say that, hey, once we remove the problematic, you kind of clean up the diet, then the next step is to say, okay, we're beyond just dietary problems as root cause issues. Now we have to look at some of the other factors. And yeah. Dr. Eric and I talk about what's something called the cell danger response. I'm sure you've kind of seen Dr. Navio's paper and done looked into some of his research, but physical stress, chemical stress, emotional stress, microbial stress, all things that can stress the system. And once you stress the system, now we get a host of issues going on where we now start to get the activation of that cell danger response. It's my opinion, and I think the opinion of Dr. Erica, that when that cell danger response kicks in, we start to have cellular hypothyroidism. And then that ties into a host of issues. And you did a great job pointing out that, one of the big things we see in people who have chronic GI overgrowth is they have low stomach acid, right? And a lot of these people come in on reflux medications. Well, you have to have sufficient thyroid hormone in your peripheral cells to make stomach acid, right? So it does become this convoluted thing. If I go into a cell danger response, now I'm going to deactivate stomach acid because I'm in fight or flight. I don't need to digest, right? I don't need rest, gas, and sex, right? And so we're going to have decreased stomach acid production because the body's more kind of we're more in fight or flight mode, but we don't stop eating, right? So we continue to consume and eat. We're not listening to the signals necessarily of our body. We live on habit, right? And so we continue to consume food, and then you put that food in, it doesn't break down appropriately. We don't kill the organisms. We don't absorb magnesium and all the other minerals and vitamins you talked about. We don't stimulate appropriate bile acid formation, so we tend towards leaky gut because we don't have bile to maintain tight junctions. We have decreased pancreatic enzyme, and it just creates this cascade
of issues.
Right.
Yeah.
So I think that part's perfect. And so then we see the things that then maybe tailor us towards having to go through those different dietary things, right?
Mm-hmm.
When you talk about FODMAPs and specific carbohydrate diet. So do you see for your hypothyroid patients that those are pathways that you have to take some of those patients down? Do you see tie-in? Okay.
For sure. I mean, a lot of my patients, I would say a very high percentage, 8 out of 10 have some form of IBS. And as you guys know, like based on the work of Dr. Alison Seebecker, she states that about 84% of the biggest triggers of IBS come from SIBO, or small intestinal bacterial overgrowth. So, but how to deal with that with the dietary tactic is, like a lot of these patients, they're having constipation and diarrhea, like one or the other, or both. And they're having a lot of bloating, they're having a lot of cramping, a lot of gas, a lot of flatulence. And a way to deal with that is to go on a low FODMAPs diet. And it's basically foods that these bacteria eat and produce a lot of the symptoms and these gassy symptoms, let's say. So yeah, for sure, addressing that and it's kind of like this. It's kind of like if you have like on your skin, you've scratched yourself, right? You're not going to take sandpaper and start going like this, it's just going to make it worse, right? So that's what's going on in the lining of your intestine. You want to give those villi an opportunity to kind of heal. So for a lot of these patients, I may steer them away from raw vegetables for a while and have them do cooked vegetables so that that fiber doesn't inflame the lining of their gut further. And for a lot of people, things like garlic and onion, which are very healthy foods, but for this population, it just causes them a lot of grief and a lot of pain. Cabbage, a lot of grief, a lot of pain. Broccoli, which those cruciferous vegetables are so important for those detox pathways. So initially, I may tell them to just avoid until we get the gut into a better state of health. And so, yeah, definitely doing low FODMAPs diet or a diet that helps decrease the pain of transit of food going through the digestive tract is very important.
Yeah, I think one of the things
you mentioned something about the nutritional deficiencies and, you know, talking about that with Hashimoto's patients and even patients who have, you know, any sort of chronic health problem, you know, deficiencies can be really, really important, whether that be selenium, magnesium, all those minerals. How do you address that with your patients? Do you try to go to supplementation, or you try to find that root cause? Because I think there's kind of two schools of thought. There's some people out there who just want to push supplements and say, hey, if you're deficient, let's just fill that pothole, let's fill that void. Or do you want to go more to that root cause and maybe look at stomach acid, or maybe try to get the health of the digestive system so you can absorb some of those?
I think from how I'm practicing now with patients is that I would say a mixture of both, and I would say it depends. So there's a lot of patients out there that I try to let my patient lead me, and so there's a lot of patients out there that they just want to feel better, so they just want to start taking these supplements to give them some sort of boost. So I work with them and I do supplement them. Personally, I love the finding the root cause route. I want them to find what the root cause is. So if someone is telling me that they have a lot of reflux when they eat, or they feel a heavy feeling in their stomach as soon as they eat, or they feel bloated as soon as they're eating, all these are signs that there's low stomach acid there. So I will try to address that first before giving them a whole slew of supplements to take. And I typically start with the diet. It's a diet first approach because that's the easiest place to start, you know, changing a few habits around. And depending on people's progress, that's how I'm going to supplement or not supplement, and then also try to find some root causes. Here in Cyprus, for those of you who don't know, Cyprus is an island in the middle of the Mediterranean. And here in Cyprus, we do not have a lot of the functional medicine testing available. So doing a comprehensive stool test, for example, you would have to go to mainland Greece to do it. And so, but it's starting to catch on. I think I've done so many talks and so many podcasts over here that people are starting to understand that there's more to finding your root cause than just, you know, popping a pill. So people are starting to catch on and starting to look at other things. For example, I had a patient that his skin was like covered in red patches. He was so itchy all the time. And I said, did you ever check for parasites? And this was like an ongoing 2-year thing that he was going through, and he was really suffering. And he went to the doctor, did a stool test, and sure enough, he was full of parasites. And he went through the right medication. We also did a lot of work with his diet to help with an anti-parasitic diet. And, you know, that was his root cause. That was, you know, like that's an easy case, let's say, like it was just parasites. But I definitely am a person that I want to find the root cause, and I try to work with diet first and add supplements accordingly.
Yeah, I think that's the approach that both Dr. Eric and I kind of advocate is, you know, start with the stuff that's, you know, really cheap, free, and you really probably need to address anyway, and that is clean up your diet, step one. Supplementation, I think all of us would agree, supplementation is a huge help to help some people get back to where they are. But we can easily overdo things with supplementation. I just made a post talking about vitamin D, and we have this thing right now in in the functional medicine world where everybody needs to be blasting themselves with vitamin D. And I think we have to be super cautious sometimes with recommendations that, hey, just take more, take more, take more. And everybody needs high dose of things, because if you put something like, we'll use vitamin D as an example, load up the body with it, it has to do something with it or it becomes a problem. And so it either has to convert it into a usable form or it has to deactivate it, and it has to do something with it. So we can create other nutrient depletions by over supplementing something. So I think
like magnesium.
Yeah, and so we take a look at supplementation for what it really means, which is to supplement or support a process. But then once you get that process geared in and you get it healthy and functional, I think the important thing for our listeners to understand is there's not too many things that you need high doses of for any extended period of time. Definitely not for a lifetime. There are a few things that unfortunately we probably need to support. I would say that magnesium, at least in this country, is probably one of them, because the soil is depleted of it. A lot of the minerals are just they're just depleted in our soils. Therefore, they're depleted in our food. And if they're processing the food, then the minerals are getting destroyed anyway. So I would say the minerals are probably one of those things that we could all benefit from some additional support from. But that doesn't mean everybody all the time. So
Exactly.
to segue into the next piece, and it's kind of a tough thing because we just talked about, hey, you don't need to supplement that stuff. But from a dietitian standpoint, you've worked with, you or yourself, a Hashimoto's patient, you have hypothyroidism, you work with patients that have hypothyroidism, you wrote a book all about how to kind of help recover from thyroid issues. What are the biggest challenge you see, nutrient depletion issues that you see in patients struggling with chronic hypothyroid symptoms and Hashimoto's?
I think the biggest or most common nutrient depletions are exactly what you said, the minerals. Our food system is not what it used to be. Even in Cyprus, I would say it's really sad. Even 30 years ago, everything in Cyprus was organic. And now it's not by any stretch of the imagination. And what we're seeing is a lot of symptoms. Let's take magnesium, that's a pretty common one, that are having to do with magnesium depletions, like severe headaches, migraines, muscle aches and pains, cramping, inability to sleep. Magnesium is that anti-anxiety mineral, right? It makes you feel like more calm. It can help with your anxiety as well. And so we're seeing a lot of these kind of symptoms that have to do with a lot of mineral deficiencies. Selenium is another big one too. Selenium is also depleted in the earth. So a lot of people say, cool, I'll just have 2 Brazil nuts and I can have selenium. But no, you can't, because you don't know how much selenium the dirt had that those nuts grew in. So we don't really know if you're getting enough selenium from eating those Brazil nuts. So yeah, I mean, these are typical ones for me to supplement. And there is research for selenium that if we're taking about 200 to 400 micrograms per day, depending, it's not the same for everybody, that we can see a decrease in those antibodies after a while. And again, I don't keep them on selenium. I always take them off for a break. And because like you said, if you find the root cause, then you don't need to keep supplementing and keeping them on like a high dose of selenium, because that can cause other issues. And also I find that zinc is another big one that's depleted. And again, it's just interestingly enough, all these things need stomach acid to get absorbed into your body. So it's not a matter of over supplementing. It's about finding a delicate balance between how your body's assimilating these foods and these nutrients. And keep in mind, everyone, that nature is an amazing thing. Foods are made, your body recognizes foods. It doesn't recognize supplements necessarily. It recognizes this balance of food. So for example, seafood, fish, you're getting this amazing balance of zinc and selenium and omega-3 fatty acids, and they're all working together. And as soon as you eat that fish, hopefully it's wild caught, and your body's just like, oh, cool, I know what to do with this. It knows how to assimilate all those nutrients. It works together. Man has still not figured out how to, take nature and put it in a bottle. I'm sure we would have done it by now if we knew how to do it. So don't underestimate the power of diet and changing your diet as your go-to in really having the supplements work for you. Because if you're just taking a whole bunch of supplements and you're eating fast food, it's not going to do much. They really, like you said, Dr. Eric, have to be a supplement to an already very nutrient dense diet. So that is my go-to. I mean, it's cool that I'm a nutritionist because that's what I've been studying for the past 20 years, you know. Start with diet first. And Hippocrates, who is the father of medicine, I have to talk about him, he's Greek, right? He said, let food be thy medicine and medicine be thy food. And he also said, all disease begins in the gut. It's amazing, this ancient wisdom. We're just starting to unravel it right now. And I think if we just, I talk about this in my book too, I say, let's go back to having common sense. My parents tell me now, common sense nowadays is not so common anymore.
I would agree with that.
So as far as people changing their diets, what do you see as being the biggest hurdle for people making that necessary change from, you know, maybe the processed diet that they're currently eating? What's the biggest struggles that your patients often go through to be able to make that change?
Well, I think we're all creatures of habit. And if we're used to something, we're very reluctant to change that. And what I think most people see is that they see this huge mountain in front of them. Like, how the heck am I going to change? Because most people nowadays, they don't even know how to cook. You know, more and more people, like from my generation and getting younger, like we just depend on other people to feed us. So I think that's one of the biggest challenges, getting back in the kitchen, going back to basics and learning how to cook for ourselves. It's not as complicated as, you know, we don't have to be master chefs and like, hey, a little bit of this, a little bit of that. No, you don't have to do that. You can be as experimental or simple as you want to be. But I think that if you put the driving box back, you know, you put yourself back in the driver's seat in terms of preparing and sourcing and preparing your own food, that is, and once you kind of get over that hurdle, that's the game changer. That's when your health starts changing. And I think people are scared of that. They're afraid of cooking. They're afraid of getting back into their kitchen. They think it's overwhelming, but it doesn't have to be. It's small, sustainable changes every day. I talked about with a friend with a podcast yesterday, and I was telling him, like, you know, sometimes maybe your first step is like, have a going away party for all your junk food. You know, throw it away, invite other friends to eat it, whatever. Just, you know, make your peace with it. Just make it go away. And then the next week can be, well, gee, I really don't drink any water. So I'm going to start drinking maybe a cup or two of water every single day. And then the next week can be something like, you know, I really don't eat any vegetables. Maybe I'll include some lettuce in my sandwich this week. It doesn't have to be so complicated. It doesn't have to be from 0 to 150 miles per hour in 5 seconds. We are creatures of habit, and it takes time to change our habits. So that's one of the biggest hurdles I see. Don't think it's a mountain. Take time to just make small, sustainable changes that you are able to make and keep in your life.
I think that's great advice. I think the biggest challenge that I see with patients is that it's fear, right? And so
Yeah.
Fear and comfort. So whether the food they're eating on a regular basis, many people know that the food they're eating is not healthy for them. Some people don't realize it, but a lot of people realize it. Hey, this isn't good food, but they don't really fully understand the impact, or they're so comfortable with their current state, and the idea to shift from what they know to something they're not familiar with is scary. And it's just easier to stay with what you're doing. But I think you're right. If you make small incremental changes, you can see dramatic changes in relatively short periods of time as you make those changes. But you just have to be committed to it and just keep plugging forward. And I think for the people who are worried about there's nothing, I won't have anything good to eat anymore, you have to focus on really the positives versus what you get versus what you're missing. And I see, and probably both of you both see, that once people really start investigating the full realm of what's actually available to eat, they find out there's so many great foods that they're not eating or weren't eating. They develop a new taste for foods that they once thought that they just didn't like. And the world opens up. And so probably you guys hear the same thing. Well, there's just nothing to eat. I'm eating the same 3 or 4 things every day. Well, listen, and I think Dr. Eric has talked about this before. They were eating the same 2 or 3 foods every day anyway. They were just processed foods. And all we're really doing is saying, hey, switch that. Even if in the worst case scenario, you ate the same 2 or 3 meals of whole foods every day, real food every day, you'd still be better off than the 2 or 3 meals of processed food. So there's so much of good quality food that you can find and start to eat, but it does take some getting out of your comfort zone and challenging yourself a little bit. And I think that's the first hurdle is to start to small changes and focus on what the benefits are and what the options and the opportunities are versus what you're taking away from yourself.
Yeah, definitely. Focus on your why you're doing this. It's, having that purpose to change and to start feeling better. And also just like anything, just like starting a new job or getting a degree or learning something new, you're not going to know everything from the second day. It takes time, and anything that you learn is like incremental and slowly. So allow that for your diet too. You don't have to be so hard on yourself, because a lot of people, the American society is like, we need to do stuff fast, fast paced, we got to do it yesterday. And that's just not how the body works. The body needs its time. It needs its time to go. It needs its time to rest and refuel. It needs its time to just be. So, and the brain needs time to adapt and create new synapses so that we relearn new habits. So I think a big piece of advice that I do work on a lot with my clients is don't be so hard on yourself. Focus on the process and don't focus so much on, like, for example, with weight loss. I get a lot of Hashimoto's patients that I've done everything. I've done every diet. I barely eat anything. I exercise like a crazy person, and I'm just gaining weight. And so I tell them, well, listen, let's not focus so much on the scale. Let's focus more on how you're feeling and on the process of what you're doing with your diet. And, because obviously that adrenal dysfunction kicks in when you're so stressed out about something and over exercising and not allowing your body to rest properly, that your body will do the opposite of lose weight. So, kind of calming people down and telling them that changing your diet slowly and focusing on that process more and having weight loss be a nice side effect will get you to your goal faster, effectively, than doing so many stressful things at once to your body.
Great. So go ahead.
Making sure that you're not beating yourself up is really important, because mistakes are going to happen. Stressing out about you're going to be going to a function, you're not going to have complete control over the food you're going to be eating. You have to just know that you're making the best decision or choice possible, and not beat your head against a wall and not sit there and stress about it, because that stress is going to cause you more issues in the long run than if you made a bad decision that one time. I think people overlook the amount of stress, the way that it can affect the body and affect thyroid physiology. And we've talked about this on many different podcasts about, your body really doesn't know the difference between an emotional stress, a physical stress, a chemical stress. So, the foods that you're eating, although it may be toxic, you stressing about trying to eat a healthy diet can be just as detrimental to your overall health.
That's an excellent point. Exactly. I stress that a lot with my patients. And, it's funny because I have so many people that they're like soldiers. They're like, I've done the AIP and I've done everything you told me to, and I'm still not feeling better. And I'm like, maybe it's time to start focusing on meditation to get their bodies back into balance and starting to feel better. So yeah, excellent point. I totally agree.
So Tina, we want to kind of get working on wrapping this podcast up, but you came out with a book. It's called Tired of Being Tired, correct?
Yeah, Tired of Feeling Tired.
Yep. So can you tell the listeners what the focus of that book's about and what they can get out of that book so that they rush out and purchase it?
Sure. It's It's basically a beginner's guide to nutrition with hypothyroidism. I talk about, my first chapter is focused on the gut and what are some important things that we can do to start repairing the gut and feeling better with the gut. I give a little bit of information about how to go on a gluten and dairy-free diet and how to stay off the processed stuff. I give some information on that. I go into nutrient depletions, what are some common nutrient depletions, and how we can supplement if we need supplementation. Of course, always with the supervision of a functional medicine doctor or nutritionist. And I go into what the AIP protocol is and how to follow that. And I also talk about stress and how other hormones affect the whole thyroid balance, and give some herbal remedies and adaptogenic herbs and how those can play a factor in dealing with stress, and also some lifestyle changes that we can address to better deal with stress. I also talk about detoxing, and if we do detoxing, what that looks like for the thyroid patient, because for this particular population, a lot of people will recommend things like spirulina and chlorella, which are packed with iodine, and for certain patients, iodine can not be a good thing for their thyroid, depending. So you want to be careful with a lot of the detoxes that are available to purchase, and just really focus on eating the foods that will help your liver to detox. So I talk about that in my book as well.
Great. And I know you mentioned that we had a discussion, you've got a big event coming up at some point here, right?
Yeah,
so
yeah.
Give us, our listeners, a little bit of information on that.
Yeah, in about a year in January, because January is Thyroid Awareness Month, we are having the first ever Thyroid Healing Summit in Europe, in Cyprus. And we're going to have a lot of speakers come from all around the world to talk to us about holistic approaches to dealing with your thyroid issues. And hopefully we can get Dr. Eric, coax him to come out and speak for us as well. So, but I'm really excited about it, because it's really putting awareness and education out there to people. And the reason I wanted to do it physically at first and not online at first is so that we get a chance to actually connect with other human beings. I find that in this high technology world that we live in today, we're kind of stuck behind screens and not really connecting with one another. So I think it's a great opportunity to meet other practitioners and other patients and have an opportunity to talk with one another and support each other.
I think it's a great idea. I think there's so many summits out there, and I'm one of those people, even if I sign up for it, unfortunately, I may hear one or two of the things and then I don't get to the rest of it, right? I think you have a conference where doctors and nutritionists and dietitians and can all get together. You're kind of forced to kind of learn in that environment. And one of the things I find, I'm sure, Dr. Erica and even you may say the same thing, many times there's great learning that occurs during the presentations, but some of the best education you get is in the wings, in between those events, where you're picking somebody else's brain in a one-on-one or one-on-four situation, and you're just getting gem after gem of information from people who, because they weren't the speaker, you would have never gotten that information. You wouldn't have got it necessarily on an online summit because you may not have paid attention. So I think it's a great idea. I think we have to become, even though we're doing a podcast right now, we have to become less plugged in, and we have to get back to this social interaction, whether it's individual people or even the physicians and the experts that are trying to help them get better. We got to get back to true socialization and away from too much of this electronic communication.
Yeah, I mean, human connection, it's one of the basics. I don't know if you've heard of the Blue Zone studies.
Yeah.
But they went around the world to see who lived the longest. And one of the biggest aspects to living a long life is having human connection and someone else to live for, having that purpose of being with somebody else. So it's such an important aspect of health. One of the things I tell my clients all the time is, do you have a support system? And I'm not talking about, an online forum. I'm talking about physical people that you can call up and say, hey, I'm not in a good place. Can you come over? These kind of people. And the people that do see a much better result than the people that tend to be by themselves and antisocial and not really connecting with other human beings.
That's a great point. So if somebody, obviously if somebody wants to get in communication with you, we'll put your social contacts available. But do you have a website, or where's the best place to get the book, or how can they find more information out about the summit in the future?
Sure. For my website, you can just go to thyroiddietician.com. I have all of the information about where you can get my book on there. It's available on all sites throughout the world. So Barnes & Noble, Amazon, Book Depository, I believe, is another one that it's on. And also with the Thyroid Summit, you can just go to the thyroidhealingsummit.com, and we have all our speakers listed up there. We have some big speakers, which we'll be announcing shortly as well, that are quite well known in our industry. So that's very exciting. And you can definitely follow me on Facebook and Instagram as the Thyroid Dietitian. And I'm very good about answering back in a pretty decent time frame. So anybody that wants to reach out and just ask a question, or has an idea that we can reach out to more people and help support each other, I'm all open. My ears are all open. I want to help.
Awesome. All right. Well, we'll wrap this up. Dr. Erica, and any final parting words from you?
No, I just think that it's great that, you've transitioned out of what a normal dietitian you were able to step outside that box and kind of then take a 360-degree view of the human body. And I think that's amazing what you're doing. And kudos to your continuing knowledge of trying to learn more about the functional medicine, because it is, the more you get into it, the more you realize what you don't know and how much there's so much more out there that you could expand on. I think that when we think that we know it all, we're really limiting, we're putting those blinders on again. And so by keeping your blinders down and always expanding and learning, I think is absolutely amazing.
Thanks,
Awesome.
Dr. Erica. I really appreciate it. And thank you so much for giving me the opportunity to talk today. I really learned, I even by talking this small amount of time with you, I learned so much. So thank you for that.
All right. Hey, we learned a ton too, and I'm sure the listeners will learn a bunch as well. So we will look forward maybe to have you on in the future. And I recommend everybody go out and grab the book and start doing your homework on how you can help improve your health and your thyroid physiology. And check out Tina's website and see if there's more great content you get there. If you have any other questions about thyroid physiology, any questions about the podcast, you can reach out to Dr. Erica or myself wherever you see this podcast or listen to it. And if you're bored and you have nothing better to do, go to iTunes and give us a real high rating on the podcast so we keep putting out great content. So Tina, thank you so much for coming on. Dr. Erica, take care. Have a great day. And to all our listeners, thanks for tuning in. Thanks for all the great questions, and thanks for the great commentary on iTunes. Take care, everybody.
Thank you.